Today, we're diving into a fascinating question. Can walking barefoot on the earth actually heal you? Let's explore the science behind grounding, also called earthing, and see what the research says. What is grounding or earthing? It is a therapeutic technique that reconnects you directly with the earth's natural energy. It's as simple as walking barefoot on grass, sand, or even using grounding mats indoors. The idea is that the earth has a negative electrical charge. When our skin touches the ground, we can absorb electrons that may help neutralize free radicals in our bodies. Pretty cool, right? The earthing hypothesis proposes that by reconnecting to the Earth's surface, we might reduce inflammation, stress, and pain, thanks to these free electrons. But remember, this is still a hypothesis. That means it's an idea based on early evidence, not yet proven beyond a doubt. So, what does the science actually say about grounding? Let's take a look at some studies. A study was conducted in 2018 to determine the effects of grounding on massage therapists' quality of life and pain. A stepped wedge cluster design was incorporated into a 6-week, double-blind, randomized controlled trial procedure with 16 massage therapists. Therapists were not grounded for the first week, were grounded while working on clients and at home while sleeping for the next 4 weeks, and then ungrounded for the last week. After 4 weeks, therapists experienced significant increases in physical function and energy and significant decreases in fatigue, depressed mood, tiredness, and pain, while grounded as compared to not being grounded. The aims of a study conducted in 2024 is to analyze the effect of grounding on chronic diabetes wound healing. 21 subjects having type 2 diabetes mellitus, taken by the purposive sampling method, were used for the study. Earthing intervention was carried out for 1 hour every day for 30 days. The results indicated that the significant effect of grounding therapy on accelerating diabetes mellitus wound healing. Another study was conducted in 2022 to investigate the significant difference in the length of acute respiratory infection of preterm infants before and after earthing therapy. 192 samples of sample size 20 were used for the study. 1 hour of grounding per day. Earthing duration is 1 hour every day for 30 days. The results indicated that a significant difference in the length of acute respiratory infections among preterm infants. Sounds promising, right? However, all these studies had small sample sizes, lacked diversity, and placebo effects weren't ruled out. If you want to try grounding for yourself, here are some simple ways. Walk barefoot on grass, sand, or soil. Lie directly on the earth at your local park or beach. Swim in natural bodies of water like lakes or oceans. Use grounding mats, socks, patches, or blankets if you're indoors. What are the potential benefits of grounding? Grounding may help with chronic fatigue, chronic pain, anxiety and depression, sleep disorders, even cardiovascular health. But remember, most of the research is early stage. Always think of grounding as a complement to traditional medicine, not a replacement. Are there any risks? Walking barefoot is usually safe, but using grounding devices can carry a risk of electrical shock, especially if you have a medical implant, a heart condition, or a recent surgery. Talk to your doctor first. At the end of the day, grounding is a simple, low-cost way to reconnect with nature. Whether it helps your health in a big way or just makes you feel more peaceful, it might just be worth a try. Just remember, it's not a miracle cure. If you have serious symptoms, always check with a healthcare professional. Thanks for tuning in. If you enjoyed this video, give it a thumbs up. See you next time. Stay grounded, everyone.